Now that your Gleason grade has been determined, it is important to determine the stage of disease. Stage refers to the extent of the cancer and in simplistic terms means whether or not the cancer is confined to the prostate, which we call localized prostate cancer, or if it is spread through the prostate capsule or beyond to other parts of the body. The TNM staging system is the most commonly used staging system, and that determines what potential treatment options may be available to you. These clinical stages are further subdivided into a more detailed classification. Shown here is the complete TNM staging system. If one has a biopsy and the prostate feels normal on digital rectal examination and the biopsy reveals malignancy, that stage is what's called a T1C stage. If one can feel a nodule in the prostate, that could be a T2 cancer. A T3 malignancy would be one that has grown beyond the prostate or into the seminal vesicles, which are structures behind the prostate gland. And a T4 cancer would be one that has spread beyond the confines of the prostate to distant parts of the body, most commonly lymph nodes or bone. Once the Gleason score and the clinical stage of prostate cancer is known, as well as the PSA value, we can assign a relative risk to that particular malignancy. Low-risk prostate cancer patients in general would be ones with PSA less than 10, a Gleason score less than or equal to 6, and a stage T1C or T2A cancer. Intermediate risk cancer patients would be placed in a category where the PSA is between 10 and 20, the Gleason score is 7, and the clinical stage is T2B. High-risk cancer patients include those patients with PSAs above 20, Gleason scores of 8, 9, or 10, and either T2C disease or T3 cancer. This information is simply used as a guideline since not every patient falls exclusively into one of these three categories. This information will be helpful in determining whether or not certain testing is necessary to see if the cancer has spread, and also to determine what the best treatment options are for the patient.